everybody. Today we're going to talk about Foley catheter insertion. When you get ready to do this skill, you're going to want to have your supplies all ready to go. That includes a bowl with soap and water and some exam gloves. You're also going to need your Foley catheter insertion kit, and then you're also going to want a leg strap. For now, I'm just going to put this leg strap back here for safekeeping. So before you get started with this skill, the first thing you're going to want to do is verify your order, because you want to make sure that you have the right patient and the right procedure. So I have verified the doctor's order, and now I'm going to go into the patient's room and explain everything to them. So I'm going to go into the patient's room, knock, knock, walk in, wash my hands. I'm going to go in, I'm going to say, "Hi, Mrs. Smith, my name is Angie. I'm going to be your nurse today. Can you tell me your name and date of birth?" And you want to confirm this with the bracelet that they have on their wrist. So it's a 2-patient identifier, name and date of birth. And you're also going to want to assess if they have any allergies. So I'm going to ask Mrs. Smith, have you ever had a catheter before? Did the doctor explain that to you? Did he explain what he wants to be done today? And she'll say either, yeah, she's had a catheter before, or no, she never has. You want to explain what the procedure is and why she's getting this catheter put in. What you're going to want to do also as a nurse first is you're going to want to do an abdominal assessment. Is she having abdominal pain? Is she having any tenderness or distension in the bladder area? If you have a bladder scanner available, you can also get that out and scan her bladder to see approximately how much might be in the bladder. So Mrs. Smith, I'm going to get my supplies ready, and then I'm going to come back in, and then we're going to do the procedure. So then you're going to go out and you're going to get your supplies, and you're going to bring them back in. One thing I want to do is lift the bed up to working level, because you're going to be kind of bending over a little bit, and if you can save your back, that's great. And once I get it to a working level, I'm also going to put this side rail down just so it's out of the way for me. You're going to want to take their sheets down here, and then you're going to want to pull their gown up, and then you're going to kind of want them to bend their knees and spread their legs. And now I have the work site that I need, and then I'm going to try to provide as much privacy as I can at this point, so you can kind of move the blanket back up a little bit. But before I do anything, I'm going to put my gloves on, my exam gloves, and I'm going to take my soap and water, and I'm just going to do general peri-care. Once I do that, I'm done with these gloves and I'm done with the water, and I'm just going to put that over to the side. I'm going to wash my hands again. So I'm going to take my Foley catheter kit. I'm going to open it. I'm going to pull it out. For documentation purposes, it's important that you know what kind of Foley catheter you put in, like what size. 14 French, it always says it on the box, so just make sure that you remember that for documentation purposes. And then you're just going to throw that away. You're going to need a trash bag, and I would recommend using this trash bag that your kit came in. Just don't put it like that, because the minute you are cleaning for sterile, you're going to contaminate your hand if it's like that. So what I would recommend is fold the top down, fold the edges down, and then just put it at the foot of their bed. And you see how it's just standing straight up like that, so I can easily just drop things into it, and I don't have to reach into it. So I'm going to open my Foley catheter kit, and I'm going to start distal, and it's folded in the way that you should open it. So side, grab onto the little edges. Do your best not to let it flop back over on your sterile field. Sometimes you have to bend it or pull it, and then you're just going to take that out. The first thing that you're going to see is a sterile drape that you're going to want to put down between their legs. So you're just going to want to pick this up There's usually a little lip on it that you can grab. Sometimes they're really, really sticky, so just do your best. You're going to want the shiny side down. There's all kinds of fancy ways to put this on the patients in between their legs, but just do your best as to not contaminate it. Because so see, this is my sterile area now. Next thing that I see is my sterile gloves. So I'm going to pick those up and I'm going to put them over here. And by now, you should be pretty comfortable with donning your sterile gloves, but I'm going to walk through it anyway. So you open your gloves, you bend the crease a little bit so it stays there. Try not to back yourself up in a corner when you're doing this. If you need to move the bed over, move it over. Like, just take as much space as you need. And then you're also very, very careful not to go over your sterile field here. But I have plenty of room here. And I'm bending this down. And again, the 1-inch border, I can touch that right now because that's considered not sterile. So I can touch 1 inch all around until I get my sterile gloves on. And then I can't touch it, right? Because right now it's not sterile and I don't have any gloves on. So I'm going to look at my gloves. I'm going to don my dominant hand first. So I'm not going to go like this. I'm just going to come over here, peek this up, pick it up, see where I'm at, slide my hand in. Sometimes they're really, really sticky. Sometimes they slide right on. Okay, so there's one of my hands. And then I'm going to use this one. If I need to hold my glove thing still here, I can hold this, the one outer inch border here. And then I'm going to pick this up. Once I have this how I want it to be, I need to make sure that I keep my thumb away from the action here, because my thumb would be contaminated here. So I got to keep the thumb out. So that just slides right on. Now I'm done with that. So now I'm going to pick up my sterile drape. This is called a fenestrated drape, and I can touch this wherever now because I'm sterile. So it's called a fenestrated drape, and it just helps to preserve the sterile aspect and just keeps everything nice and clean. I would recommend not patting it too much and arranging it too much, because in doing that, you take a higher risk of contaminating yourself. So what I notice when I open my box, I see some betadine, I see swabs, cotton balls, I see some forceps, I see lubricant, I see a 10 ml syringe full of water, and then I see a urine specimen cup. So I'm going to take this urine specimen cup and I'm just going to set it over here gently, because if I needed a urine specimen, then I could get that now, put that there. The next thing I'm going to do is fluff my cotton balls, because this is helpful to do beforehand. You see how they kind of were sticking together? If you fluff them and separate them before you put the betadine on, it just makes your life a lot easier. So when you open the betadine, there's a little spot that says open here, pour here. Be careful, because when you pour this during your psychomotor skill, it's going to come flying out. But the reason we want you to do it is so that you know how it feels when it comes out. When you're practicing, you don't really open it, but when you're doing your skill, you will. So it just comes out. You pour it over all of your cotton balls. And then you're just going to want to put that to the side. Then you're going to kind of want to fluff those, get them all nice and betadined up, nice and clean. Okay. So now that I've done that, I'm going to move this over here a minute, put that there, because I need to attach my 10 ml syringe to the balloon, and the balloon is what keeps the Foley catheter in place. There's a teensy little bit of air in these syringes, so just kind of get that out a little bit. And it hooks right here. All you do is just hook it up. and then lay it right back down. And then you're going to get your lubricant. It comes with a little cap on it, so just take the cap off. There's 2 places you can put the lubricant. It's whatever works best for you as you're practicing. Figure it out, and you can do whichever way works best for you. The important thing is with this skill is that you maintain sterility. I like to just squirt it in the corner of my box, and I'll explain that in a second. You can also squirt it here in this box, and I'll explain that in a minute. For me, I'm just going to put it right in here, squirt it right in there, and then I'm done with that. So what I want to do, the catheter is wrapped up in a nice little blue plastic bag, but be very, very careful, because if you're not careful when you're taking this out, it can be really, really floppy and flop all over the place and contaminate your tip. So done with that. So the reason I like it in the box is because it's right here. And you gotta play with this a little bit because it's really bendy. The lubricant is right here. So I can just lube that right there, and then I'm just gonna put it right back down in there. And then I'm gonna take this and put that back on there. And now I'm ready to go over to the patient's bedside here. So I would encourage you guys, when you're moving this, to pick it up like this, as opposed to how you're going to want to do it like this. The reason is when people do it like this, they easily contaminate their hands because they're bringing it over like here, and they're putting it down, and then their hands are touching the leg, and they don't realize it. So it's always a good idea to just pick it up like this and just put it there, and that's it. Now you explain to the patient, Mrs. Smith, I'm going to touch you now. I'm going to get the betadine swabs. It's going to feel cold, but I'm going to clean your labia with that so that we make sure to prevent any infection. So now you will verbalize that you contaminated your left hand because you need to spread the labia apart. So you want to get your forceps, and you want to get a cotton ball, and you want to take the cotton ball, and you want to clean the labia majora, top to bottom, go around your sterile field, and drop it in your trash bag. Come over and get a second cotton ball, clean the labia majora, top to bottom, go around your sterile field, and drop it in the trash can. And then you're going to clean the labia minora, top to bottom, around, and drop. The other side, labia minora, top to bottom, around, and drop. And when you do this skill, we do need you to say the body parts. Like, don't just say I would clean over here and over here. Make sure that you're saying the exact anatomical parts. Then you're going to pick your last cotton swab up, and then you're going to clean the urinary meatus, top to bottom. So now I'm done with that, and I'm done with this, and I'm done with this. But I can't move my left hand because now that I've cleaned and sterilized, I don't want to move my left hand because I'm keeping the labia spread apart. So the reason that I like the lubricant in the box is because now I can just take it, and if I want more lube or whatnot, it's right here. Otherwise, it's way over there now. So to me, it's more handy here. So you're going to want to pick up your Foley catheter, and you're going to explain to Mrs. Smith, I'm going to insert the catheter now. And if you could just take a big deep breath in, just try to relax. You just want to insert the catheter into the urethra, and once you get it in, you go until you see urine return. But when you see urine return, you still want to go just a little bit more because you might still be in the urethra. Just because you see urine doesn't mean you're necessarily in the bladder immediately. So once you see urine, just go a little bit more. And then the urine should be flowing out, and you should be able to clearly see it. You're just going to kind of want to hold this right here. Pick this up, your 10 ml syringe of water, and you're going to want to inflate the balloon. The balloon is what keeps the Foley in the bladder. Now, if she's having pain or anything at this point, that might indicate that you're still in the urethra. but if it's in the bladder, it doesn't cause pain. So now that I've inserted the fluid, I can't just let go of this plunger because see how it just automatically comes right back? It's like a pressurized system. So I want to keep my thumb depressed on that. I let go here. I let go now. Bring my left hand over here and disconnect my syringe. And then I'm just putting this down. At this point, I'm not sterile anymore, and I don't need to be because the procedure is done. Good job, Mrs. Smith. You're going to kind of want to clean up. You want to pick your Foley bag up, and you're going to want to attach it to a non-moving part of the bed. And then also, there's a lot of tubing here yet, and you want to kind of make sure that this isn't pulling on their bladder. So this is why you have the leg strap, and we're going to put that on, and I'll show you that. It's just kind of a Velcro, goes along about mid-thigh. And give it a little bit of slack so it's not pulling, because that wouldn't be very comfortable. And about at the Y tube site here, you just kind of hook that on there. That should stay there. And then this little clamp here is nice because when the tube can sometimes coil down at the end of the bag, and then if it coils, the urine just sort of stays in the top of the tube and it doesn't drain down. But if you sort of secure this so that it coils here and then continues to drain down, that's the safest way to promote urinary drainage. When you're done, then you're going to want to take like a tissue or a washcloth and just do peri-care and clean up. And then the things that you want to document with Foley catheter insertion are, of course, the amount, because you don't just want to put the Foley catheter in and then walk away. You want to note by the time you're done cleaning up, attaching things, peri-care, you want to look in your bag here and you can see how much, pretty much how much came out. So I would say 1,000 milliliters, clear yellow urine. You know, if it had any blood to it or just what it looked like. Give the patient the call light. Put the side rails up. Bed down. Are you doing okay, Mrs. Smith? Yep, she's doing great. And give her the call light. Side rails up, beds down, gloves off. Wash your hands, and then you're going to go document.